Serious police officers and nurses, what's the most fluffed up thing you have seen on the job? Attention! Serious tag notice jokes, puns, and off-topic comments are not permitted in any comment, parent or child. Parent comments that aren't from the target group will be removed, along with their child replies. Report comments that violate these rules. Posts that have few relevant answers within the first hour, and posts that are not appropriate for the serious tag will be removed. Consider doing an AMA request instead. Thanks for your cooperation and enjoy the discussion. I am a bot, and this action was performed automatically. Please contact the moderators of this subreddit, message, compose, to =r_askreddit if you have any questions or concerns. Deleted. Deleted. Guy convinced a friend to drill a hole in the back of his head because he read somewhere that it alters the flow of cerebrospinal fluid to give a permanent high without any drugs. Somehow worked out with no bad effects except that he and the friend just left it open for like 2 weeks and the cut edges of his scalp started rotting. I could literally see into the inside of this dude's brain through the dime-size hole he had drilled, not sure if penetrating the brain itself was intentional or not. But the god-darn shocking thing is that, except for the infection in his scalp, the guy was otherwise completely fine, told me all about what he did in a totally coherent manner and then extolled the virtues of drilling into your skull over taking drugs. Removed. Deleted. We have a frequent flyer who repeatedly comes in because she gets glass dildos stuck up her ass. She's already had to have emergency surgery twice because they break after she puts them in. She puts them in the freezer first. I once had a patient who was suffering from an addiction to alcohol and cocaine. He had snorted so much cocaine that his entire nose was gone. The amount of nose you see on a skull was the same amount what he had left. Also, because he smoked 2 packs a day for over 30 years, his pharynx throat wasn't functioning properly, therefore, he had to be tube-fed. Now usually when patients are tube-fed, this is done with a probe through the nose and into his stomach. Now the probe was just loosely hanging out of his nose socket. If you would pull it a bit you could see stuff moving in the back of his head. Because of the substance abuse, this patient had significant liver failure and could not qualify for a liver transplant. Now there is a certain enzyme your liver produces which is responsible for keeping the pressure and the amount of fluids in your cells at a normal amount. Due to his liver damage, this enzyme could not be produced anymore, or at least his liver produces way too less of it. So, over the course of a couple of days he began to swell up, his legs, his belly, his arms, basically everything was full of fluid. During his stay in the hospital, he gained almost 40 pounds of excess fluids which just accumulated in his body. Because of this, his skin was stretching a lot, which caused excruciating pains for the man. Even the strongest morphine could hardly ease the pain. Fortunately for him, he died after a couple of days. That was no way to live. Edit. It was albumin which his liver could not produce anymore. Got a call of medical aid request, male subject and chainsaw-related injury. Showed up and found a male in the middle of the street, head in one place, body in another. Chainsaw still running. Guy had found out his wife was cheating on him with his own brother, got drunk, put the chainsaw up to his throat to show them a lesson. The chainsaw teeth caught his neck and just kept going. Young girl in her 20s kidnapped and held captive for days. Every inch of her was bruised, they shaved her head and eyebrows off, burnt her. Just some seriously fluffed up stuff. Only found by chance. I don't want to imagine what would have happened if she wasn't. No family came to see her either. She was truly isolated and alone with no support. I think that just made it so much worse. Removed. For me, the most fluffed up thing that I see as a nurse are loved ones that refuse to let their sick and miserable family members pass with dignity. I know losing a loved one is hard, been there, but instead of stopping treatment, they want us to continue doing everything possible for their 90-plus-year-old grandparent. We as medical professionals know that they aren't leaving the hospital or nursing home, and family are advised as such, but want us to continue full code status. This means doing CPR and breaking multiple bones when they code. For me, it's the calls involving kids. The kid in the group home that gave me a copy of her poem about being raped by an older guy and molested by a foster parent. The kid's cell phone ringing as his mom tried to reach him. He was wrapped around the dash of his Dewey brother's car. The kid sitting on her dad's lap when his throat was slit. But the one that still irks me to this day is the guy whose baby mama decided to cheat on him. He got even by slaughtering their infant with a butcher knife. He tried to kill himself after and fluffed that up. It was a fluffing blood bath. Don't quite have the words for that one. Had a faculty member of the college I work for have a heart attack on the stairs, fell down and slid down an entire flight of about 30 steps, on his face, each step breaking his nose slightly more than the last. His nose was basically flat and he was pouring blood everywhere. IIRC, lost a few teeth too. I used the AED that was thankfully right there beside the stairwell, before I had to do CPR on him, while trying not to get his blood in my mouth, for a whole 14 minutes before EMS, FD got on scene. Had an officer show up, and he just stood beside me and watched. He didn't attempt to provide any kind of first aid or CPR relief. After about 2 minutes of CPR your efficiency drops significantly. I was doing it over 6 times as long. EMS finally arrived and rushed him to the emergency room and thankfully the guy survived. And X200B, by far, not the worst thing someone has dealt with in this line of work before, but it was traumatizing nonetheless. And X200B ended up being honored with the first life-saving award the college has ever issued. I should also point out, I am only a security guard, and I was only on the job for 2 months before this happened. One of my patients sneezed out his intestines. He had a hernia so severe the skin had stretched to the breaking point, so all it took was a sudden increase in abdominal pressure and bam, edit to elaborate. He had had multiple surgeries to repair the hernia in the past that all failed. He came into the hospital looking like he had swallowed a basketball. The skin around his belly was very thin and darnaged, so all it took was a sneeze to rip the skin and all of his bowels came shooting out. Not a single loop of bowel, basically all of it, since he had little support in there at all to keep them in place. He survived the initial trauma since evisceration is not as immediately fatal as it may look if the bowel is undernaged, but I think he had a very poor long-term prognosis. Homeless person with an infected foot just came in last month. Foot was red and necrotic, dead tissue. Little black holes everywhere. Poured some iodine and a few maggots came out. Another nurse suggested hydrogen peroxide, that hole bubbled and 1,000s of maggots came bursting out. I can't even describe the smell. Was in the ER. A young girl was brought in, beaten and messed up. She was alert and oriented though, and was fighting with paramedics and ER staff about assessing her. Turns out she was only 12 or 13 years old, beaten by an uncle, and refused to say anything until her daddy showed up. Of course no one showed up, at least, when I last checked at the end of my 12-hour shift. Things that happens to children are the most fluffed up. Removed. So I have been a nurse for over 10 years and I have to be honest, so much of my experiences are not as gory or traumatic as so many others here and never will be. But for me, and I know that some of you might understand, the most fluffed up things I see and will continue to see is the horror of Alzheimer's, frontal temporal dementia, and Lewy body dementia. I tell you what, these PPL come in and they are polite and confused, able to fake it sometimes. Maybe their families have cared for them at home for a long time. Within hours often they realize they aren't leaving and the family is gone. The facade is over. They become mean and nasty often. Or the traumatic weight loss, the refusing to eat, the empty look in their eyes. Begging to be released from their shell of a body in their own personal hell. Unable to verbalize the pain or confusion or anything they feel. The families going through this is sad too. But what I was reminded of was when some of these folks do get sick, or break a hip, or poop themselves. The amount of people it often takes to help them and clean them up, literally have to try to hold their hands down because they do not understand what's going on no matter what. So yes, imagine 4 feet 10 inches little old lady who is 90-some years old. In the shower, with 2 or 3 staff because she's swinging and pissed off, but hasn't had a shower in over a week, and starts with diarrhea. One girl gets sick, so old lady grabs the poop and starts smearing it on her, ends up standing on wet floor with other 2 gals in there trying to hold on to her and keep her off the floor and get her clean, throwing handfuls of poo at the girls, the doorway, and the wall. And here comes Iowa_popcorn RN knocking on the door in her dress clothes as the assistant director of nursing, trying to help people, and gets poo landed at feet. Removed. I'm old, so this was a long time ago. I looked after someone who had attempted suicide on the train tracks. They survived but lost both their legs. Everyone was just JFC, they were suicidal before and now they are going to be living with a significant disability. I'm a labor and delivery, high-risk obstetrics nurse. The most horrifying thing I've witnessed is the birth of a deformed, mutated stillborn. It was unlike anything I've ever seen. Gelatinous, balloon-like, oozy. The image is burned in my brain. The mom knew the baby wouldn't look normal and asked for it to be taken away immediately and did not want to see it. I don't blame her. I wish I hadn't.